Hello, I'm Dr. Jimmy Douglas, and let's see what steps to take when a dog bites you, be it a stray dog or your vaccinated pet. First, wash the wound, the scratches, and the adjoining areas with plenty of soap and water, preferably in running water, for at least 15 minutes. If soap is not available, then simple flushing with water should be done. This step is important in prevention of human rabies as it is done to remove as much virus as possible from the site of bite before it can be absorbed on nerve endings. Do not cover the wound and don't try to close the wound. Leave it open. And next, you would be visiting your nearest hospital or doctor, as every instance of human exposure is treated as a medical emergency all over the world. What happens next is your doctor would assess the wound, clean the wound again thoroughly, and then advise accordingly. He or she would categorize the type of wound and the treatment plan accordingly, as early intervention can prevent rabies. And wound category according to the World Health Organization is given here. Now that the dog has bitten you and the action that is taken after being bitten, it is called as post-exposure prophylaxis. Now, according to the nature of the wound, your doctor would take a call on whether to give you rabies vaccine or rabies immunoglobulin or both, along with antibiotics and anti-tetanus measures. Taking anti-rabies vaccine or rabies immunoglobulin at the right time can save your life. Now, what is rabies immunoglobulin? Rabies immunoglobulin is a type of passive vaccine. This means it provides immediate but short-term protection by introducing ready-made antibodies into the body, given immediately post-exposure and before the symptoms appear. The immunoglobulin is typically given alongside the rabies vaccine. Prevention of human rabies. Prevention is possible in the following ways. Number 1, after dog bites you, that is post-exposure prophylaxis. Number 2, before dog bites you or pre-exposure prophylaxis. Individuals who have already been vaccinated are bitten after the dog bites you or post-exposure prophylaxis. Post-exposure prophylaxis is when the dog bites you, the rabies virus, which may be present in the saliva of the dog, is prevented from entering the nervous system. Prompt and adequate local treatment of all bite wounds is of utmost importance, as it is done to remove as much virus as possible from the site of the bite before it can be absorbed on the nerve endings. Schedule for post-exposure prophylaxis. Essen Regimen, 5-dose regimen, prescribed dose on days 0, 3, 7, 14, 28, which requires 5 visits. Zagreb Regimen, 4-dose regimen, prescribes 2 doses on day 0 on 2 different injection sites, followed by 1 dose on day 7 and 1 dose on day 21, which requires 3 visits. This will help initiate quicker immune response. Your doctor, considering your ability to visit multiple times and other factors, would take a call on this. Now, if you ask, can we take rabies vaccine without dog bite? Yes, it can be done. It is called as pre-exposure prophylaxis. This is for people who are at continuous exposure to increased risk, as in animal handlers, veterinarians, lab workers dealing with rabies virus, children living in rural areas. The vaccination schedule is day 0, first dose, day 7, second dose, day 21 or day 28, third dose. Let's also see what happens if individuals who have already been vaccinated are bitten by the dog again. For those who can document previous complete pre-exposure vaccination, then 1 dose of rabies vaccine is given on days 0 and 3. Consult your doctor for more information. Thank you for watching and see you in the next video. Bye-bye.